bit as we've had some technical issues. We are reading from paper notes rather than the screen. So just bear with me. But really, this is an overview of what we'll be covering today. So we'll be covering what is a typical reaction to cancer, and is there a normal reaction? What it's like hearing those words, you know, you've got cancer, and how distressing that can be and why it's so distressing for people at diagnosis. And then we talk about the other points of the journey that can be quite distressing as well. Then of course we'll be covering some coping strategies that we I guess recommend really help people. That's not to say you don't have your own strategies in place that are working really well for you. It's about what you might be able to take home today to add to those, and thinking about new ways of coping. And then I'll go on to talk about communication, so how to talk about your diagnosis with other people. Communication is a huge challenge for a lot of people, and we find that comes up a lot in the one-to-one work that we do with people. So I will be talking about how to talk to your tamariki, your whānau, your friends, work, how to communicate with all your medical team as well. That can be difficult. As well as the importance of support seeking and how important communication is and getting the right support for you. Okay. So common reactions, these are just a few of the main ones. There'll be things that might not be there that are relevant for you, but generally when cancer comes along in life, it's unexpected for most people. It's uninvited, and it's almost like life comes to a crashing stop. There's this sort of real interruption of your current routine, and plans go on hold or things get cancelled. Whilst it sort of just completely sort of dominates everybody's headspace, sort of getting their head around what's going on, what are the treatment options I have to consider, understanding your situation. And that could be really hard when emotionally people are usually highly distressed, and they're also needing to process a lot of complex medical information to understand their situation and figure out what do we do and what's going to be happening. And again, it is a time of real intense emotion. There's going to be those fears around treatment, and how will you cope, what's it going to be like, as well as I guess naturally those fears related to further ahead into the future. And catastrophic thinking is a psychological process that we refer to, which is really just not necessarily thinking about a negative outcome, but it's the absolute worst case scenario. So it can be those fears about mortality, and the ultimate worst case scenario might not even be someone's mortality. It might be the meaning of that. It might be sort of missing out on time with kids, or not being able to fulfill important ambitions. For some people, there's going to be a lot of worries about how's this going to affect my relationships with my spouse or with my children, or, you know, those sort of intimate relationships, as well as some real challenges to fertility for some people. And we know that it is what is normal is it's a really significant time of distress. So we spend a lot of time normalizing those feelings, and every range of feeling comes to the surface, and often people don't know how they'll react to that news until it arrives. So there really is no perfect or certain way that people should react to cancer. Everybody is really, really different, and communication, again, a really, really challenging issue at this time. I think something that I've sort of experienced in my time here is people will hear one thing and their families will hear another thing when the doctors are explaining what's going on, and there can be that processing of information just doesn't happen quite so clearly when people are really kind of emotionally aroused. So often there's that sense of sort of watching the doctor's mouth sort of opening and closing, but not really taking in information. And that's the shock, and that's the sort of the numbness of, you know, receiving that diagnosis. Okay, and you know, a lot of people do say, what's normal? Am I normal? I'm crying. Is this a sign that there's something wrong with me? Does it mean I'm not coping? Well, actually, what I say is it's a normal reaction to something abnormal, because it is usually, for most people, it's an unexpected shock. It can be quite traumatic, and it's going to take some time to settle. And usually what we do notice in most people, the normal pattern is that distress is intense for a few weeks, but then it does settle as people kind of adjust and come to terms with this news and what it means. But it does take a few weeks and sometimes longer. We know that distress for most naturally settles over time, and as people sort of go into treatment, and once people start treatment, it can sort of it can become a bit more predictable and routine. But certainly that roller coaster kind of experience is really common for most. It's those ups and downs and those bumps along the way. It's constantly ever changing, and the roller coaster analogy is really fitting because there's a lack of sense of control, not really sure which direction you're going. Are you going left, right, up or down? What's around the corner is the uncertainty and the feeling that you're not really in charge of what's happening next week. And that can feel naturally really destabilizing for most people. And there is, like I said, a really wide spectrum of emotional reactions as well. Every experience is personal. And the difference really that I guess we become quite able to sort of distinguish is when that distress becomes overwhelming, prolonged. That's when we kind of might say, you know, maybe it is important to get some psychological support for that distress. If it's not settling, if you're feeling like it's just interfering with your life and your mood is low and flat all the time, that's quite different from the ups and the downs, where you have good days in between those tough days. Okay. So based on our research, and I guess other studies that back this up, there are peaks of distress across that journey. Diagnosis is the big one, but also just before start of treatment, people can have real wobbles, and that's natural because everybody is usually quite fearful of how am I going to respond to chemo, what's it going to be like. You haven't met any of the medical team, and once sort of people settle into that familiarity and the sort of regular cycles, it becomes a bit easier. The other one to watch out for is the end of treatment. So it's a really fragile time for most. There can be the sense of expectation from family and friends that you can bounce back into life at 100%, and that you're all going to be normal again. And actually, there's a really quite a long rehabilitation phase, and often people can feel very, very tired, and emotionally they can really struggle at the end of treatment, and there's lots of reasons for that. And it's just good to sort of be looking out for that and knowing that could be a wobbly time. So that's often a time when we do pick up a lot of supporting people when they're coming to the end of treatment with those specific post-treatment challenges. So common emotional responses. Certainly the sadness, and there's a lot of loss that comes with those changes that cancer brings. With any change, there's going to be a sense of loss, a sense of kind of adjusting to those temporary losses, like loss of hair, or it might be some permanent losses if you kind of have to have surgery to remove certain parts of the body. It might be the loss of time. It can relate to lots and lots of different things. And we talk a lot about the psychological losses, a sense of safety, sense of certainty, sense of control. Those are the three. that can be really shaken up in the way that people think. Fear and anxiety, again, connected to that sense of not being so in control and having that uncertainty. And it's how do we learn to sort of tolerate the uncertainty that cancer brings, and that threat to your sense of safety and that real sense of increased vulnerability. Often people can feel really angry, and that's normal. There's nothing wrong with feeling that way. The anger can sometimes be directed at just the situation and the cancer and why me. Sometimes people might feel angry at themselves if they hold a belief that they've done something to cause it. So often that's something we explore. And if people are spiritual or have a faith, that can really rock their beliefs as well. And a lot of questioning around, why. People look to meaning make. As humans, we need to take meaning from our experiences. We need to make sense of why is this happening. So there can be a lot of time spent processing, thinking through the whys. Grief and loss I've sort of touched on, but also that self-blame and that guilt. So there can be a real sense of guilt around the burden or how this is impacting those around you, or particularly people that might blame themselves. Something I've done wrong, or it was because I was really stressed, or and we do a whole separate talk about stress and cancer, but certainly what we do not tell people is there's a link between how stressed people are and how likely they are to get cancer. There's not a strong enough link, despite that being a really common myth out there. It can just cause a lot of unnecessary blame and guilt and distress on the person that has been diagnosed. So lots of different emotions here, but the one that can sometimes happen for some people is that numbness when everything's too much. We can sort of have a bit of a psychological mechanism where we shut down emotionally, we avoid because it's all too much to cope with, and almost sort of just disconnect emotionally. So some people might sort of explain that they just feel really flat and numb. And again, that's a response that is normal, and it just takes a bit of time to sort of lift the lid on those feelings and begin to unpack them a little bit and what's underneath that numbness. Again, normal to be upset, normal to cry. Strong, intense emotions are part of the human experience and part of those reality shocks that come along. And if we think about what's the purpose of an emotion, what's the function of having emotions? They're communication signals. They tell people in our tribe, everything's not okay with me. I'm not okay. I'm struggling. If others are able to see that on our faces, then that's how we get support. That's how we get connection. That's how, as humans, we're social creatures and we bond and we have that alleviation of suffering, that soothing from others around us if they're able to see our emotional responses and how do we communicate that. And again, if you're feeling overwhelmed by your emotions, absolutely appropriate to seek professional support by talking to someone in our team. So as psychologists, we know that we have physical responses to our emotions. So at points of really high distress, we're going to have some physical signs, and some of these will be familiar with you, but usually sleep is a big one. With any distress, usually sleep will suffer. And then that has a bit of a knock-on effect on other things, like we might be more likely to feel fatigued. We might be much more emotional if we're not sleeping so well. So it can be a bit of a vicious cycle. We might see an increase in muscle tension, pain, soreness, headaches, stomach upset. So kind of digestion changes are really common at that point of sort of really high distress, as well as feeling a bit lightheaded or dizzy. This is all your body going into sort of fight flight, because cancer is a naturally very threatening word to most people. The body goes into that fight flight response, and it's sort of dealing with the sense that you're in immediate danger, something really dangerous happening. And so your body's reacting kind of how it should do, because it's it's got this message from the mind that you're not safe. And so it's sort of about how do we kind of manage those physical responses so that they don't compound and get caught up into that vicious cycle of feeling physically unwell as well as emotionally struggling. So we are really big on relaxation strategies, breathing, and there's a lot of other kind of really practical ways of relaxing that you will all be using that help you manage some of these symptoms. Okay, so I guess moving on to coping strategies, I've talked a lot about, well, what's the experience like emotionally? What's it like being diagnosed? But importantly, I want to give time to talk through how to cope with cancer-related distress. Again, quite different from your depression, your clinical level of depression, which is sort of low and flat. Cancer-related distress is often just really turbulent. And so that's a slightly different approach to someone who's, say, depressed, but it can still be useful to keep these in mind if you have low mood as well. Okay, so we know there are lots of different ways that people cope with distress. I think often there can be that challenge in relationships if one person copes differently to another. If one person isn't really a talker and never has been a talker, we can't expect them to suddenly change because cancer's come along. People who aren't typically kind of really expressive emotionally, talk a lot about their feelings, they're not going to suddenly start doing that. They're going to use the strategies they've always used in life. And typically there are two main types. There's distraction and there's attention. And as I talk through these, you might begin to sort of get an idea of which one you lean towards, but the ultimate sort of goal is to have a really good balance of both, and I'll explain why that is. So attention and distraction, both are really helpful. We want a good dollop of both. If we are using too much distraction, it's a problem. And if we're just attending to our distress all the time, that's also exhausting. It's very draining to be attending to our distress and thinking 24/7 about the cancer. And often it can feel like it's 99% of your headspace all the time. If that's the case for you, you're going to need to bring more distraction in. It has a bad reputation, but distraction is actually really useful at the point of when someone's diagnosed or during treatment even, can be really helpful. Gives us a bit of a mental vacation. It allows us to recharge, provide some space, some distance from cancer. So you come back to it with often a different perspective if you've sort of not been thinking about it for an hour or so. So what sorts of distraction strategies do people use? There'll be all kinds of things that you might already be doing. Typically these things are using your body, your hands. They're absorbing, they require a focus. So cooking and baking, art, anything creative, your gardening, anything which requires you to coordinate your brain in a certain way will leave you with less opportunity to worry about the cancer. Things that really keep you in the present and ground you in quite that sense of mindfulness are really, really helpful and protective. So people who are creative, people who do things which are about making stuff or using your hands, cooking, baking, all of this stuff can be really helpful to sort of retain during cancer. Because if we kind of use things like reading or TV, for some that can help. So kind of absorbing yourself in a really binge-worthy Netflix series. That can be really helpful distraction for some, but others, the TV isn't quite enough. They can still be worrying a lot in the back of their minds. So it's about finding what really helps to take your mindset away from thoughts about cancer, and getting out and about, leaving your house, getting into a different environment is often really helpful. So even if your energy is really low, just going for a drive, some different scenery just helps you to sort of get that distance from being all caught up in your thoughts and feelings about cancer. And there are lots and lots of activity ideas that we do sort of recommend, but certainly those are some of the key ones. And then there's your kind of relaxation and breathing exercises as well. So on our website, we have a series of relaxation tracks which you can download. So if you search for relax in the search bar, it will come up, and you've got lots of really nice kind of visualization, guided visualizations, which can be quite useful distractions, especially when you're trying to get to sleep at night. Often we need quite an active distraction to help us switch off from those worries. And some people really love those kind of beach visualizations to just listen to. And then I think the other thing really with distraction is really focusing on those basics, the foundations. So your nutrition, your sleep, and a little bit of gentle movement. If you can get those three things right, it's going to really keep you able to cope emotionally with the impacts of the cancer. So, you know, if we're sort of focusing on getting enough sleep and enough rest, emotionally you will find that you can kind of cope much better. And the studies show that our amygdala is very overactive if we haven't slept very well. And the amygdala is a part of our brain that's it's all about responding to fear and danger. So we can be very in that fight flight more when we haven't slept so well. So often we do focus a lot on sleep because it does drive everything else, emotionally and physically. And we do a whole separate talk on that, which I can sort of give you the schedule for. We are really big on self-care as well. Often that can go out the window, particularly if you are a supporter. But it's really important. Cancer is the time when you want to be really kind to yourself. Lots and lots and lots of self-care, time out, things that you know make you feel good. Keep all of those things in your week, if as much as you can. And it is the time for lots of pampering. And we'll just help you cope with that marathon journey that is often, you know, can be 9 months to a year for some people with cancer. It can be longer. So we've got to kind of have lots of little recharge opportunities. And self-care, yeah, just as important for the cancer patient as well as the supporters. So moving on to attention strategies. If you know that you're big on distraction, maybe this might be something that you want to bring in a little bit more. So usually the kind of people in this world that are predominantly attention focused, they tend to like to gather lots of information, do lots of reading, lots of researching, ask lots of questions, want a really good understanding of their diagnosis and what it means and what the treatment options are, what it's going to entail, and tend to sort of spend a lot of time thinking about the cancer. Often the people in this world who are really good planners, organizers, but can also be prone to worrying more about the future. You are more likely to be an attender. And there are some good things about being able to focus your attention on your distress, and that's really because it helps us process the meaning of what's happening to us. It helps us sort of pay attention to our emotions, how we're feeling, and actually process the whole experience and grow long term from it. But what we do say is that if you feel like those worries are out of control and that you're sort of hard to switch off from them, it might be sort of putting a time limit on how long you do spend thinking about the cancer. And it does sound a little strange, but we do sometimes recommend people try something called worry time. So it's sort of choosing a time slot in your day, not too close to bed, where you set an alarm for half an hour and you allow yourself to just write down what you're worried about, everything that's going through your mind. Some of those worries will be specific questions that maybe your medical team could answer for you. And some might be more just general what ifs. But just getting it out of your head and onto paper can be quite powerful. And it's also some way of being able to share that with others, share those worries. Talking to someone you trust who is helpful. So people who are talkers and find it helpful just to verbalize their worries might really benefit from talking to friends, family, as well as professionals as well. So it's sort of putting a little bit of a boundary around your mind if you know that you're prone to getting lost in worry and it can really just take over most of your day. It's using distraction. So use your worry time, schedule it as a sort of restricted amount of time, and then plan something really distracting after you've finished so that you're kind of beginning to put some control in place with your mind. Because if we're attending to worries about cancer all the time, that's only going to become really draining and have a really big emotional impact. But having said that, when attention-based strategies are done well, it can really help us problem solve and plan and organize. Helpful self-talk. So this again is really fundamental to our emotional well-being. The way we talk to ourselves is critical in how we feel and how we behave and respond to cancer. Are we beating ourselves up? Are we telling ourselves some really scary stories? Or are we kind of supporting ourselves with kindness, with compassion, with encouragement? So it's sort of not always easy to do, easier said than done to develop helpful self-talk, but it can be very, very powerful. And we do focus quite a bit on that in our one-to-one work with people. How do we kind of, think differently about things? And it's about balanced, realistic thinking. What we're not saying is that just got to think positive, because we know that can be quite unhelpful in many situations. It has to be balanced and realistic. Okay. And so having a bit of a plan can actually be really important, because in the midst of really strong emotions, it's impossible to think practically and rationally about what do I need to do that's going to help me right now. Because our frontal lobe and our executive functioning part of our brain, which is responsible for thinking about what to do, that just disappears. It goes offline when our emotions are really strong. Our emotional brain takes over. So writing down ahead of time can actually be really helpful. Keep it really simple. And it's just basically having a few distraction and attention-based strategies that can help you when you're feeling really frightened, really down, whatever those feelings are, planning ahead, and as well as kind of sharing it with others as well. So for example, it's going to look maybe a little bit like this. So thinking about what activities are really useful distractions for you. Whether it's kind of, having your kind of guitar nearby, or whether it's getting into some baking, having a list of things that you write down. It seems like a small thing, but if you've written it down, it's much more likely to happen. And all the research tells us this. If we just sort of mentally have that in our head as a plan, it's less likely that we'll implement these strategies. So Really important to write these down after the talk today if you do have some time. And then on the other side, thinking about attention-based strategies. So what can I say to myself that's helpful right now? What is it I need? Who do I need to talk to? Have the phone numbers of your nurses, or your psychologist, or anybody that is really important to turn to. Question, have those written down. But I think potentially, you know, reminding yourself that emotions are time limited. They do pass, they go up and they come down like waves. We're not caught up in the intensity forever. It does come down. Remembering you're human, and being human involves having some strong feelings, and that doesn't necessarily mean there's something wrong with you. It's okay to feel frightened. It's okay to feel whatever feeling that you're having. It's when we judge ourselves for the feelings we're having that we get into trouble. So it's just allowing yourself some space for those feelings to be there. And thinking about, who do I need to talk to? Do I need to have a really good cry? Because that's a coping mechanism. Crying releases a natural sedative, so it kind of helps us get to sleep. That's why babies have a good old cry sometimes before they fall asleep. Okay, so really just having a bit of a guide here can be helpful for people, and thinking about how can I balance the attention and the distraction-based strategies. So I have a good amount of both in there. So I'm going to just take a couple of minutes. If people need to have a quick stretch, stand up, feel free to do that. If you want to go and get a cup of tea, we'll come back in maybe a couple of minutes and just carry on. Okay, so I'll get going again. And so what we're going to do now is move on to the communication part of the talk. I love this picture. I didn't choose it, but it's really cool because it kind of represents people are kind of, it's that sense that, you know, they look like they're kind of trying to figure out what someone's saying to them. And that's often the case, is often those around you might be kind of guessing what you need and how you need to be supported without really knowing fully what it is you need. And so often these are the thoughts that people will have around communication and why it can be so challenging and wires can get crossed so easily. So I don't know how to explain that things are different now. So often people who have been through treatment for cancer, you know, they can't seem to sort of explain to those around them that I can't do as much as I used to be able to do, or things aren't the same as before. There's those post-treatment effects. And on the outside, people might look exactly the same, but on the inside, emotionally, physically, things are really different. And it's, how do I explain all of that to someone? How much information should I give? How much should I tell my children? How much should I tell my colleagues? How much do I want to tell? Who should I tell? I don't understand the information the doctor told me. That's a big one. The jargon is really challenging for people to get their head around, and you can have two people who hear different things in a consultation, and then there's all that kind of confusion about what stage is this and what grade is that, and what does all of that mean. It's so hard to get your head around processing all of that. And who do I ask if I need clarification? You know, I don't understand what the doctor's told me. How do I ask for help? I still don't understand what's going on. How can I get someone to explain? How do I tell her or him that I want to help? So often your supporters around you, they're going to be sort of second guessing what you might need without really asking clearly. And so it's around how can we kind of make that communication really good. The reason communication is so important is because it's going to get you the support you need. If we're communicating well what we want from others in the way of support, and they understand what we need, then they're more likely to be able to match that. So that often, you know, there is that mismatch where people are getting a lot of food deliveries or all at the same time, and then it's not what they need. Okay. So I guess starting off with, you know, a few of a rough guide that we recommend is don't feel you have to tell the world straight away. Tell people when you're ready. I've worked with a lot of people who say, I haven't told my parents because I just want to wait until I've had my surgery and then I'll know more about, or I just want to wait until this point in treatment and then I'll know more. I don't want to unnecessarily alarm them until I know more. So often people will not sort of tell everybody straight away, and that's okay. It's feeling in control. Cancer takes away a lot of control from people, so it's often something people can feel in charge of, who they want to know, how much those people know, and when they know. The setting is going to be important. So, you know, considering, you know, a sort of a neutral or a setting where you're not sort of going to be in public. So that person that hears the news isn't going to sort of feel overwhelmed by, you know, their own response if it's a public place. And importantly, it is about communicating what do you need from them. So anybody who is in your world, in your life, whether they're close family and friends or whether they're a wider community, they all have the potential to be supporters for you. And the more people that you can elicit help from, the better you will cope. The research consistently shows the more support people have, the more people are on board with supporting you, the better you will cope. Very clear predictive factor. The other thing is to prepare for other people's questions, particularly kids who will come out with the really blunt questions. Are you going to be okay? And sort of have some things written down around what am I going to say if they ask this, if they ask that. It is okay to say, I don't know. It is okay to say, we're not sure. Really important not to lie, especially to little kids if the outcome isn't necessarily certain. The other thing is about sort of delegating or giving the sort of job of communication to someone you trust. So a sibling or a partner or a friend who can maybe organise a chat group. So they're responsible for doing one update, and then all the people in that chat group get the same update. And then you're not getting bombarded with lots of calls and emails. They know if they want to find out what's happening with you, maybe go to the update page. A Facebook page is often what people do, but it might be a chat group. and sort of just having that boundary there. So if you're feeling really overwhelmed by people contacting you all the time, you can sort of separate out from it a little bit. Communicating with health professionals can be a big challenge. People do sometimes sort of find it quite distressing when they're told one thing and then they're told another thing by a different specialist, and it feels like they're not really sure what's going on. Again, really distressing, really hard to take on board everything that's said in that first diagnosis appointment. Often there needs to be lots of sort of summaries and repeats, and some people will record a consultation if the doctor lets them, so that you've got the exact, can listen back to it. It's okay to ask for clarification. It's okay to say, can you repeat that? What does that mean? Can you draw it for me? Can you explain this to me visually? Or can you simplify it? You know, it sort of is really straightforward information for them, but I think, you know, for us as lay people, we need that real sort of simplified explanation. What does it mean for us? And I think it's also useful to know whether you are someone who likes the minimal information and what do I need to do, or do you want to know everything? You can be in charge of letting your specialists know, hey, I don't want all the fluff. I just want the basic direct information. I don't want any kind of, you know, niceties. And other people actually want information to be delivered to them in a much more gentle way and in a different. So knowing how you like your doctors to talk to you is really important, because you can communicate that to them when you first go in. You can say, hey, can you share information with me in this particular way? That's how I best cope. And then it will help them understand that. Always take someone with you for a consultation. It can really help. They can take notes, they can ask questions that you might not think about, and just really helpful for the emotional support as well. Again, get doctors to write stuff down for you. Get hold of a number. So ask, who can I call if I have questions after the appointment? So usually it's your nurse specialist, and make sure you have that number so that you're not kind of left feeling confused without knowing who to contact for clarification. Okay. So talking with your family, again, separate challenge. People and families can respond really differently. It can be a huge stress when some people respond with huge anger or emotions and other people don't. There can be really different responses. Some people will withdraw and not talk at all. Some people will become very outwardly distressed, and both of those can be a challenge for different reasons. Again, I sort of mentioned earlier that we can't expect cancer to necessarily dramatically change someone's communication style or their style of coping. If people aren't strong verbal communicators, that's not their way of coping, that's okay. Sometimes people cope by actively kind of doing. They have another way of expressing their feelings, another outlet. So often it might be through music, or it might be through writing, or it might be through doing, you know, being out and about on the property. Often it can be that gets pathologized or judged if people are not talking much, but it can sometimes be how people cope, and that's okay. Talking about feelings can be very hard. No one really got taught how to do that at school, so it's kind of understandable that can be sometimes a really difficult thing to do, and can take time for people to open up. And it's also really hard to sort of communicate what you need others to do for you to help, even with the people that you know and love the best. Letting them know and being in that place where you're kind of quite vulnerable and you're kind of saying, actually, I'm really struggling today, I really need a hug, or actually I really need to be left alone. Give them a sort of a clue as to what it is you're needing on that particular day. the biggest problem we do see with communication and support is there's a lot of expectation that people can read minds. And I can tell you there's not anybody in the world that can do that, even psychologists. Nobody can read minds. We need someone to tell us what they're thinking, what they're feeling. And it's the same with those around you who want to help. So it's being really, because our needs change hour by hour sometimes, we can't expect them to sort of know what it is we need at any given moment, because that might be different. So some days I might get home from work and need some space. Other days I might get home from work and really need that physical contact and need a hug. And then there might be other days where I just need a cup of tea. So that is going to vary because our emotions vary. Communicating with children. So I'll whiz through this because this may not be relevant to everybody, but we can always give you more information, and you can always email us if you want more information on this. But the key is being, make sure that you address this in the safety of their home, where they feel safe. It's private. No one has to be anywhere else in a hurry. Open-ended questions, so check in with the child. What changes have they noticed recently, or what do they understand is going on? Ask them to summarize back so that they haven't got the wrong end of the stick with things. Name the illness. So some people don't like using the word cancer. The problem with that is that kids can do their own research and they'll Google the name and they'll come up with, oh, that's cancer. Or they might hear it in the playground and then they can draw their own catastrophic conclusions from that. I think it builds trust with your children if you can be honest and say this is cancer, but then really explain what that actually means for them. Their day-to-day life's not going to change at all. It's not going to affect their routines. You're going through treatment, you're doing all the things, whatever it is that you've chosen to do to address it. It's okay to sort of give them permission to have a cry, to be scared, to feel down. And you can normalize that by saying, hey, I feel that way too sometimes. And if you need to cry, it's okay. The key thing is around being honest, which is what this sort of acronym stands for, is don't make up answers. You want to be honest, but you don't at the same time need to share every single sort of gory detail of what's going to happen with treatment. And it's sort of about giving the right level of information. And we have a booklet which gives you a guide as to how much to say and how to say it depending on the age and the stage of the child. And then keep it regular, touch base with them quite frequently, check in with them, how are they feeling, and just be really sort of bring it up and check in on how are they doing. And at a time when the child is most talkative, it can often be easier to talk with children when they're doing another activity like drawing or Lego. It's easier for them to sort of open up sometimes when they're doing that. So if you did want more information on that, then just let us know. We can send you some notes. Okay. And so in terms of sort of where we get support from, anybody around you can be a supporter. Animals, your pets, they can be wonderful supporters and listeners. And it's remembering to include everybody in your world. They have the potential to be a supporter. But particularly the Cancer Society, we offer lots of different support in different ways. Community organisations, if you're a member of a community, a church, looking at kind of how can they be helpful. And one of the really good support platforms that you may or may not have heard of is called Support Crew. They are a free website where you can go and set up your own page and basically create a list of what you need. Invite all your friends and family. They see the list and they tick off what they want to do. It's excellent. Really recommend Support Crew. And it's sort of looking at using people's strengths really. So your neighbour next door might not necessarily be strong on emotional support, but practically they might be amazing at being able to grab the groceries or mow the lawns. Whereas people who are maybe really, really far away in another country or overseas, they may be really great emotional support, even though they can't practically cook the food for you and be there to help with those other things around the house. It's using people for what they're good at and recognizing that usually we're better at one than the other. So we can't expect people to be really good at practical and emotional support. We've got to sort of reach out to a variety of people for those different things. And in terms of wanting to know about all the different services that we provide at the Cancer Society, you can call the 0800 cancer number or visit our website, and we can explain all the different things that we do to help people. There's meals, we have a nursing service and volunteer drivers. So just kind of briefly covering, I guess, the emotional support. There are two types. There's emotional and practical. Talking with a close friend, having counselling, you know, those are kind of the really important emotional ways of coping. Is sharing your worries, being able to talk to someone who you really trust, who's not going to judge you or come out with maybe advice that you don't necessarily want. And then there's your practical. So somebody who can drive you to appointments, bring the food, take care of the kids, sort of roster out the groceries, cleaning. All of these are really important. Just a really brief overview for supporters, because there's a separate talk that we do for supporters. But just a little bit of info for you if you're a supporter. It can be really hard for supporters to know what to say. There's a lot of pressure on them to say the right thing and do the right thing, and a lot of sort of anxiety about saying the wrong thing. And so, you know, it's knowing that sometimes we don't have to talk to be supportive. We can be, you know, physically supportive. It's just about being present or listening. Often patients will tell me the most helpful thing for me is someone to listen, someone to just sit with these feelings I'm going through, so I'm not alone in all of this, without necessarily trying to fix how I'm feeling. There can be a sense for supporters that we have to sort of instantly fix how someone's feeling, because it's very distressing seeing someone else you love upset. But actually what often they need the most is for you to just sit with that for a little while and normalize it and validate that feeling. It's okay, I feel sad too, let's have a cry together. That doesn't necessarily mean that there's anything wrong with doing that. Communicating your own feelings, as I said, it's how we get connected. By sharing our feelings, we connect with others through that vulnerability. Is a lot of good stuff that comes with sharing those emotions. But often supporters can hide their own feelings. They can be overly protective of the person that they care about. They don't want to distress them, burden them, so they keep their feelings to themselves. And what that can lead to is sort of a subtle disconnection between you both. And what you need right now is that connection. Decide what you can and can't do. So really important to have boundaries and feel like you can say no if it gets too much. It's kind of something that we're often quite strict on. If we notice somebody spending all day at the hospital with their loved one every day and they're burning out, we will encourage them to sort of step back a bit. Putting those boundaries in from the start is really important. And the top 10 tips, really, as I said, listening, just kind of being available, help out where you can, but important also not to take away someone's independence as well. You want to make sure you don't render somebody helpless, because often people with cancer can still do a lot of things for themselves. It's just communicating what they need and what they can do by themselves. Let them know you care, go to appointments, respect their need for space as well. If they're saying, hey, I'm really not great, I don't want any visitors for a few days, that's okay too. Have a plan together. So talking through those kind of practical plans can help alleviate a lot of worries about things. Cancer-free time. So often supporters who struggle to talk about feelings can be really great distraction friends. So, you know, use the friends that are not so good at the emotional side of things or the listening. Use them as your distraction-based friends for cancer-free time. So you might communicate that. Can we have a day where we don't really talk about it? Can we do something fun? And, you know, I spend a lot of time thinking about it. Maybe we have a cancer-free morning. And then they know and you know it's not going to be a topic of conversation. Notice those early warning signs for stress. So really important for supporters to spot burnout before it starts to happen. That's the biggest problem we see in all supporters, is they burn out very quickly. So knowing what are these warning signs that tell me that my fuel tank is getting really empty. Am I irritable? Am I sleeping poorly? Am I not eating so well? Have I got pain or headaches? What are those little warning signs to really listen to? And for supporters, asking others to help you, so it's not all on you, really spreading the load, and so you can have that time back to take care of yourself. Okay, good communication. So just a sort of really just a summary slide, really. Being open and honest. We know that that will facilitate better adjustment within families to cancer. And we're not born perfect communicators. It is a skill that we need to practice. No one is perfect. We all say the wrong thing, we all muck up. But it is about just sort of over time, we sort of build the skills really to do that. Using assertive communication. So for supporters and patients, this can be as important. It can be really hard to be assertive for some people. And so we have a bit of a guide here, which, you know, we will email all of this stuff out to you. Often being assertive is around recognizing what you need, expressing what you need, but doing it with respect, with a sense that you respect the other person's viewpoint, and it's using I statements. I would really like it if, you know, blah, blah, blah. And there's lots of really useful kind of info out there on how to be assertive, but essentially it is, it's about being fair, respectful, but it's also about recognizing your needs are not less important than others. They're just as important. They're not up here, they're not down here. Recognizing you're equal to those around you, and expressing yourself. How does it make you feel if there is a problem with someone's behavior? The important thing is less about what's the behavior and more about what's the impact on you. How does it make you feel? That's often the bit that we don't explain to people when we're communicating an issue with their behavior, and that's what we need to help them shift. All right, so I'll just move on to the last few slides so that we keep to time. Sometimes we don't want to talk, and that's okay, and we can express that. We can say today, I don't really want to talk about anything, and that's perfectly fine. You can write down your feelings, you can write down what you need from others, let them know. And the other thing is that we have these sort of handy guides sometimes people will have with kids, or with those who, you know, need it to be really spelled out really clearly. You know, we can have these tick box things where someone just puts a thing, you know, where they are today, or it might be the traffic light system. So if somebody who has variable pain throughout the week, they're going to have a bad day. And they might say, look, today is a red day, which means I want to be left alone a little bit. I don't want anyone jumping on top of me because I'm in pain today. Or it might be today's a green day. You know, I'm happy, everything's a better day, and you can give me a hug today. So, you know, for young kids, that can be quite helpful. Lots of different ways of explaining, particularly with your fatigue level. It can be helpful, this analogy of a battery. You can say, hey, I might look the same as I always do, but my battery today is 30%. And that visual can really help people to really get it. They really understand when you you're giving them that clear sort of concept of where you're at any given day. Sometimes people can find it really hard talking to their whānau, their friends, for whatever reason. They don't have many people to talk to. That's where I would always say seek support from us. That's what we're there for. You're not going to burden us in the same way. We've been trained to cope with big, scary emotions and it not affect us in the same way because we're not close to you. So it can be often the case that people sort of come talk to us because they don't feel they can talk to those around them. So this is, I guess, the other things we do in the service, mainly one-to-one support, anyone over the age of 18, anyone affected by cancer, lots of support people, of course, will see us as well, one-to-one. We have a moving forward group, anyone post-treatment who's sort of struggling to get back to normal life after treatment, they may be appropriate for that group. You can find out more about that through the 0800 number. We have yoga. As of next year, it will just be on Wednesdays, but that's free, that's drop-in. And we do other talks on various other topics here, which you can see. And the next one is, I think I've put it on the slide here. Yeah. So the first webinar of next year is the 20th of January at 10. And so if you'd like to be put on the list for that, stress and sleep, then you're more than welcome to join. Let us know. And that's the best email to get hold of us, psychologists@akcansoc. And any information really about anything that we do, there's an online referral form here as well to sort of seek an appointment with us. You can self-refer online, or you can just call the 0800 number or ask your nurse or GP to do that. The important thing to mention is that we're not a crisis service, so we're not necessarily available 24/7. Okay, so that is the end of the talk. And if anybody has any questions, if you want to talk to me after, I'm going to stop the recording now. So feel free to, you know, to turn your microphone on